Have you ever pondered over the morality of hastening death in the face of unbearable suffering? Euthanasia, the deliberate ending of life to alleviate pain, has been a subject of intense debate for centuries. When we talk about euthanasia, we often think of a doctor directly ending a life. This is known as active euthanasia. Picture a physician administering a lethal dose of a sedative to a suffering patient. This direct intervention to end life is what sets active euthanasia apart from its counterpart, passive euthanasia. Passive euthanasia, on the other hand, involves withholding or limiting life-sustaining treatments, allowing the person to pass more quickly. While the methods differ, both forms of euthanasia share a common goal: to alleviate suffering. But the differences don't end there. Euthanasia can also be categorized as voluntary or non-voluntary. Voluntary euthanasia involves a conscious decision by the person to end their life. It requires full consent and an understanding of the consequences. Now picture a scenario where the person can't make the decision, perhaps due to unconsciousness or permanent incapacitation. In such cases, a close family member might make the decision to end the person's life. This is non-voluntary euthanasia, which typically involves passive euthanasia. Now you might wonder, is euthanasia legal? The answer is it depends. Laws vary across states and countries. While physician-assisted suicide is legal in countries like Switzerland, Germany, and Japan, euthanasia, including physician-assisted suicide, is legal in the Netherlands, Belgium, Luxembourg, Colombia, and Canada. However, in India, only passive euthanasia is allowed. Despite its prevalence in certain regions, euthanasia remains a contentious topic. Some view it as murder, while others argue it undermines the sanctity of life. Many religious groups oppose euthanasia for similar reasons. On the other hand, some advocate for the right to die with dignity. They argue that individuals should have the choice to avoid a long, painful dying process. Despite the ethical complications, one thing remains clear: euthanasia is a deeply personal and complex issue. It involves not only legal and ethical factors, but also considerations of physical and mental health, personal beliefs, and wishes. In conclusion, euthanasia, whether active or passive, voluntary or non-voluntary, is a topic that continues to provoke thought and debate. It's not just about ending life, but also about compassion, dignity, and the right to choose. Remember to care for yourself and those close to you. Thank you for your time. Do subscribe and share this information with those you care about.